So I'm going to keep it in this mode rather than presenter mode, because every time I put it in presenter mode, then I only can see myself and I want to be able to see you all. So hopefully that is okay with you all. And what I'm going to do is just take you through what we've been doing the last 2.5 years here, because this is our first really members meeting that we've been able to have at this capacity. So, you know, what we're going to talk about is just how a little bit of seed money here has really gone a long way. So for those of you that don't know, Community Asset Builders had managed the Missouri Rural Health Association for over 15 years. They were dedicated really to finding sustainable solutions to rural barriers, still are, and how to access healthcare in our rural areas. And an opportunity presented itself with United Healthcare, and they gave the Missouri Rural Health Association the opportunity to grow, really. And so that opportunity really provided technical assistance through Community Asset Builders to the Missouri Rural Health Association. It allowed us to do some strategic planning. It allowed the association to hire its first full-time executive director. It has provided some grant writing support and resource development to the Missouri Rural Health Association. So just over the past 2.5 years, they gave an investment of $75,000 a year for 3 years. And with that investment, we've really secured over $4 million in resources to support access to care through services with the Missouri Rural Health Association, to its members and other rural organizations supported by MRHA. So the return on investment is pretty good currently. So we're pretty proud of that. Under $20 really has been that return on investment. So with those grants that I mentioned, I'm going to go through them fairly quickly, high level, kind of what we're doing with those grants. So we have grants and contracts that have been awarded in the last 2.5 years. We have a couple of them from the Missouri Foundation for Health, a couple of them from the Federal Transit Administration, a couple from the Missouri Department of Health and Senior Services, and then a few from the University of Missouri. So CAB really helped assist MRHA in acquiring funds for 2 projects with the Missouri Foundation for Health to help support Missouri Rural Health Association. One of them was funded in 2018. It was just for a year, but it helped MRHA serve as the lead for the Rural Opioid Response State Technical Assistance Team, and really helped the development and the build out of the Rural Opioid Response Hub that NU Cares through the University of Missouri really worked on and established. Then the second was funded in 2019. And that is a 42-month award that is helping really implement e-care and e-hospital. So either tele-emergency department or telehospitalist programs in 5 hospitals in the Missouri Foundation for Health Service area. So that partnership is between MRHA and Avera, which is now Avera, which is a South Dakota-based health system specializing in e-care. And John with Avera, now Avera, will be moderating our last session this week, so you can hear maybe a little bit more about that. And I'd be more than happy to talk more about that with you at a different time. So the Missouri Rural Opioid Response State Technical Assistance Team. So several years ago, HRSA released Rural Community Opioid Response Program grants to really help rural communities implement prevention, treatment, and recovery programs. So we at the state level all came together and decided, rather than us individually applying for anything at the state level, we would form a state technical assistance team. And these are just some things that we work on, and the Missouri Rural Health Association takes the lead in kind of organizing the state technical assistance team, and that serves the communities have then one point person that they can contact when they need help or resources or technical assistance in implementing those prevention treatment and recovery programs. So we have really worked to establish and maintain these networks within the communities and at the state level to address the opioid crisis. We facilitate networking among grantees and state partners. So every other month, we have a little webinar. Usually we talk about at least one big overarching thing. And then we give the grantees the opportunity to do a round robin where they can talk to each other about their successes and barriers and learn from one another. We've helped develop prioritization tools and templates to support their grant writing and proposal activities, and CAB has been very helpful with that. We disseminate information on training opportunities and best practices. Oh, Derek is telling me I'm freezing a little bit. Sorry. The internet here is not the best. But so once a week, we do disseminate information out to those grantees. On Fridays, I try to, any trainings that might be coming up or webinars that they might be interested in, funding opportunities as well. Then we try to streamline resources gathering at both the state and national levels to aid in their grant writing because there's planning grants and implementation grants. So moving forward, helping them really streamline those resources so that they can write really good, strong grant proposals and get more funding. Then that Avera partnership through the Missouri Foundation for Health, MRHA's responsibilities, it allowed us to hire Derek, who will be manning all the sessions today. But he is our telehealth coordinator, really our technology guru, if you will, when it comes to anything technology. We also needed to work with the hospital. So we were the ones that have collaborative agreements with the hospitals to work with Avera. We work on helping them identify problems where they might need technical assistance. Derek acts as that liaison between the hospital and Avera in helping to provide that technical assistance, or maybe it's technical assistance Avera doesn't do, and Derek kind of picks up where that gets left off. And then he also has monthly calls with the hospitals to kind of coordinate, how things are going to make sure that this will be a sustainable model in the future. And then Avera really does come in and does a lot of the heavy work as far as providing the technical assistance, helping them implement the services, train the staff, and Derek just monitors that to make sure that is going appropriately. Then we received 2 grants with the Federal Transit Administration, and it was awarded to help support the HealthTran initiative that we have going on and really expand mobility management in Missouri. So the first one came in 2018. We're in the middle of that right now. And that was the Innovative Coordinated Access and Mobility Grant to help support new communities improving health status through service coordination and mobility management. It helped to increase transportation, infrastructure, service, and access through HealthTran. It also helped support some technology enhancements that we desperately needed, help kind of start our implementation of the mobility management curriculum, which is scheduled to get done here pretty soon. We actually have a session on that during conference, but if you want to know more about that, Mary and Sandy can walk you through our mobility management curriculum. So at the end of it, a person will get a certificate. We're hoping to bring it to certification at some point in time. And then this grant also helped us really start to think about robust engagement of regional planning commissions, local councils of government, community action agencies to help reduce rural transportation to healthcare, to improve health and reduce costs through some regional mobility managers. So those funds were actually encumbered in July of 2020. I know it was funded in 2018. It took us a while to get things encumbered. The FTA moves a little bit slow. And then COVID didn't help either. Then the second grant was awarded in 2019. It is also an 18-month grant. This one is called the Coordinating Council on Access and Mobility, otherwise known as CCAM. And it's really to help us support that mobility management technical assistance. So kind of bringing that certificate up to where it really needs to be, that mobility management certificate, hopefully bringing it to certification at some point in time, really focusing on technical assistance, doing assessments for rural communities to different from health assessments, but a transportation assessment, trying to find what works in a community, what's not working in a community, and try to help fill those holes. So, and if we need any more updates to technology, this will help do that. It will also help support staff with mobility management technical assistance as well. This actually does not go in effect until January of 2022. That's when those funds should be encumbered by. So just a little bit more about HealthTran. You know, the ICAM grant did help us implement regional mobility coordinators. We have gotten some new regions of the state. Again, the mobility management certificate. We also did get a little bit of funding from the National Rural Health Association to do free rides for COVID vaccines for those counties that we do have a volunteer driver in. So that did kind of offset some things as well. That's actually still going on. We just kind of rolled that out. And then we also have gotten some funding and some contracts from the Missouri Department of Health and Senior Services. And this one is really to support caregiver training and respite in response to a request that the state had put out. So we did get this award. It is a 3-year award. We just started year 2 with this. So we are subcontracting with Memory Care Home Solutions to help us with the training portion of this. And then we are subcontracting with the Alzheimer's Association to help us with the respite part of this as well. So the Memory Care Home Solution provides the trainings to individuals that are caring for their loved ones with dementia or Alzheimer's. And then the Alzheimer's Association is helping us by securing those respite services for those that are caring for their loved ones with dementia or Alzheimer's and doing that intake for them as well. So this just started in November of 2022. The state, we did year 1 in 6 months. So technically year 2 started in June. So we are rocking and rolling on year 2 on that one right now. Then we have gotten several different contracts with the University of Missouri here lately. We were awarded a 4-year contract, or the University of Missouri was awarded a 4-year grant with the SAMHSA to implement building capacity for recovery-friendly communities. So this grant is really helping us continue those rural opioid response state technical assistance team duties that we have. So sending out those emails once a month, having every other month webinars with them. We did a whole 3-hour thing yesterday. So tacking on some pre-conference things for those rural opioid response grantees. And really anybody who's interested in opioid response is welcome to attend those. So, and then there might be some additional resources allocated for MRHA to assist those communities with transportation assessments if they want them or need them. Then we were also given a contract with the University of Missouri to help them do a rural workforce development conference. So the MU Rural Track was awarded a grant, and one of the objectives within that grant is conducting a faculty development to teach providers how to prepare students for rural practice. The contract was established to co-host the Rural Healthcare Workforce Conference. We actually had it in April of this year, and then we will have it again, hopefully in person in 2023. So be looking for a save the date probably here in the spring, next spring for that conference in 2023. So like I said, it was held virtually in April of this year. Its objectives really are to give healthcare administrators information on rural recruitment and retention strategies, and how to do community engagement around that. We did have some faculty development for individuals who teach healthcare or health professions to students. We had a little bit of a networking opportunity for rural health professions to showcase best practices as best as you can in a virtual setting. Hopefully, like I said, next time we'll be in person. Residents and students were armed with information on rural opportunities to help prepare them for rural practice and really give a venue for residents and students to present relevant rural-focused research projects, which if you have not seen our poster presentations on those, we do have several on our YouTube channel, and they are really good. I highly recommend, if you have not seen those, to go out and look at those. And then it also helped provide professional development for rural health professionals, administrators, and preceptors, which we are trying to get more of. And then the most recent one, actually, I just signed this contract yesterday. The University of Missouri did get a contract, an Excite contract. It was an extension land grant opportunity. And this one, we're going to be working with them to help collaborate with local rural healthcare providers to plan and execute vaccination events in their areas. They are conducting needs assessments, and I will help as much as they need me to on that. And then utilizing local guidance, decide on those vaccination events and enhance local resources within those communities as well. I know they really want to work directly with the meat processing plants. So, and really working with their community health engagement specialists in those areas. And then I am working on trying to develop an adult immunizations program to help increase adult immunization rates in our rural health clinics by increasing their technical assistance and funding for clinics to increase rates of all adult immunizations, not specifically COVID, but that's in the works right now. And then I cannot say that go through this without saying we do have an internship program. So Derek actually leads that up. He's been partnering with several educational institutions throughout Missouri for internships in rural health to help inspire the next generation of healthcare workers and develop rural competency. They aren't all necessarily going to go to medical school or nursing school. Some of them are business majors, and that's fine too, because we need rural CEOs and rural COOs and rural CFOs in our healthcare administration as well. So right now we have had 25 students that have gone through the program over the last year. He's working with both undergrad and master's level students. And he has built partnerships with 6 colleges thus far. Of course, it's all been virtual due to COVID. So that has actually kind of helped us reach out a little bit more. Other activities that we've been doing, we've been doing a lot of advocacy. I will fully admit that a lot of it has been in 2020 has been on the federal level with COVID, with provider relief funds and other COVID related funds as far as the CARES Act. But we do have an advocacy subcommittee. So if you're interested in that, let me know and I can make sure that you get put on that. We also provide other technical assistance, just, phone calls. How do I become a rural health clinic? What are the steps I need to take to, get a license for a hospital, those types of things, just providing those day-to-day technical assistance to the communities as well. And then we have been offering a lot more educational opportunities this year, and that will actually be increasing over the next couple of years. So be looking for more webinars, more maybe one-day summits rather than, big, long conferences, although we will keep the conference as it is for the next couple of years, but be looking for more educational opportunities coming out from us as well. So starting in September, or hopefully coming in September, another way to really engage members and to do advocacy and to be able to provide that technical assistance, we are going to implement a community platform through the company Higher Logic. It will really be able to help us to increase our access to resources and tools. People will be able to share those resources and tools with one another. If anybody is a member of the National Rural Health Association, this will be very similar, if not the same as the NRHA Connect. So you'll be able to email one another, ask questions of one another, share resources. There will be different communities that you can join. So this will hopefully allow that community engagement across organizational partnerships as well. So FQs and hospitals will have the opportunity to talk to one another, along with rural health clinics, community action agencies, basically anybody who really wants to be on that community platform. And hopefully we'll provide a safe space for people to ask questions and really seek support that they're looking for, and be a collaborative system that will support some email integration in there as well. So be looking for that in September. I was hoping to roll it out actually at conference, but switching to virtual kind of got in the way of where we were working on that. So we had to take a pause on that. And so hopefully that will, again, start rolling out in September. And then I could not do all of this by myself. All those people to the right of my name do all the hard work and all the hard labor. So make sure, as if you are at conference over the next couple of days, to give a shout out to my staff, because they work extremely hard, a lot of long hours, way more than 40 hours a week most of the time. And they definitely do not get the praise that they need most days. I will also like to point out that 2.5 years ago, I started in January of 2019, and it was just myself, Mary, Sandy, and Pam. So we have really grown staff in the last 2.5 years, and that really has come through because of the United Healthcare seed money that has really been able to help us grow a little bit. Be looking for a membership survey to be coming out. Probably late September is when I will probably be posting that. I'll be giving everybody obviously a couple weeks to respond to that. But in order to really move forward, not only myself, but the board needs to know what are your priorities in the next upcoming couple of years. So this will help us strategize. It'll help us update our strategic plan, potentially help us update our bylaws, whatever we need to do. So be looking for that coming out. I promise to keep it short. I know people are surveyed to death, but I really would like for everyone to fill that out once it comes out. And if that's not enough, I know you all are sitting at your desks wondering, Melissa, how can I get more involved? Well, you can. So join a committee. We have lots of, well, not lots. We have several committees. We have a membership development engagement committee. We have an advocacy committee. We have a grants and programs committee. So if you want to get involved, but you don't want to necessarily have the commitment as a board member, join a committee. They're open to, you don't have to be a board member to be on a committee. Join a committee. Maybe consider running for a board seat next year if you have time. We love to have new faces, fresh ideas. We can't, obviously do this alone. The more innovative and creative we get in our committees and on our board, the more we are going to grow and the more impactful we will be as far as, being the cutting and leading edge of innovation for our rural health. And then if you don't know if you have time for any of that, but you want to make sure that you have some input besides just the membership survey, please feel free to reach out to me. I would love to schedule a time to talk to you. I can go over in more detail any of the programs that you want to know, the bylaws, the strategic plan, any of that. That's my personal cell phone number. I'll be honest with you, I go to bed at like 8:30 at night. So if you're going to text me or call me after 8:30, you probably won't get a response till the next day. But that is my personal cell phone number. And then you can always reach me on the office phone or in my email as well. So I know that was a lot of information, a whole lot of information. But at this point in time, If anybody has anything that they would like to ask or share,